Hi, I'm Rida Grdovci, a journalist and a psychologist from the capital city of Kosovo, Pristina. I came to Istanbul to Dr. Resat Aktas to make my dream come true. Self-care has always been considered a strong point for women. We have to take care for ourselves. A well-known doctor, Resat Aktas, has a very long experience as an aesthetic, plastic and reconstructive surgeon. If I start talking about his education and the successful work he has done, it will take all our time. So now, during the interview, we're gonna know some things about him and the work he does. It is a pleasure to meet you, Mr. Resat.
It's my pleasure as well. Welcome to Istanbul.
Thank you. It was my pleasure too. I love Istanbul, and today it's my day that I'm gonna really make my dream come true. The first question I have to know is that what makes one surgeon his job special?
It's a very difficult question, but after the end of the specialization education, you are trying to find your way, and I find myself very comfortable when performing liposuction and body contouring surgeries. And on the way of that, I see that many women suffering from a fat disease named lipedema. Lipedema is a fat disorder which 10% of women are suffering from this illness, and it's an underestimated illness. Lipedema awareness is not too much. For example, you realize that you have something wrong, but you didn't know that it's an illness named lipedema. Especially in the first stages, it's very difficult to understand the lipedema, but disproportional fat accumulation in lower legs and upper legs, and also symptoms like serious swelling which happened at evenings, and bruises which you don't know the reason, and the pain is a problem for women. And also the disproportional fat accumulation causes a serious self-confidence problem, because your tummy, belly, arms are different, but your legs are different. Like you cut two different women from belly and match it, because normally you think that these legs should belong to a person who is, for example, 90 kilos, but I'm 60. So this disproportion is very important for a woman, because you cannot wear shoes, boots, the pants, the skirts, all becomes a problem for you. So what I'm doing is treating the patient not only cosmetically and also functionally, because the removal of lipedema fat, excess lipedema fat from legs, lower legs and upper legs, increase your quality of life, your self-confidence, and makes your psychologically you become very healthy.
This is, I think, the hardest part. You have to work with your clients and to make them go easier. So I want to know what age does lipedema start?
Three periods of time we see that patients start suffering from lipedema. The first one is puberty, because in lipedema we now know that fat cells have an abnormal distribution of some receptors in cellular base. In puberty, pregnancy and menopause periods, the estrogen hormone affects fat cells in bad way, and when they gain weight, actually their condition gets worse very quickly. But they cannot lose weight. They gain weight very quickly, but these patients cannot lose weight because there are some problems in the microenvironment of the fat tissue. That's why they couldn't lose weight as much as they want. They try again and again, lots of diets, lots of sports, but they couldn't lose weight, and all need try lose their self-confidence to themselves, and at the end they give up.
Maybe we have a lot of women that they are watching us, and I have the audience. I'm gonna post this, and people are gonna see in Kosovo too. They want to know about the process, the surgery. The first question, how my process is gonna go.
Actually, first of all, the evaluation of the patient is very important. Physically, I am trying to evaluate how much fat she has at legs and arms. because 30% of patients has arms illness as well. After her physical assessment, her medical history is important. If she has anemia, or if she has some illnesses, for example, enlarged veins in her legs, etc., she needs to have her vein treatments and some illnesses which we see with lipedema, like hypothyroidism, for example. Thyroid illnesses is important as well. She needs to have her medical treatments properly. After this medical history, physical examination, evaluation, we make a plan. Of course, liposuction is not a surgery that we can remove fat as much as we can. There are some limits. So according to the limits, sometimes, rarely one operation, but mostly 2, maybe 3 operations are needed to treat a patient.
Based on the fact that you are a plastic surgeon, are there many cases where clients come with pictures of artists and ask to look or change themselves according to their looks?
Yeah, it's actually a big problem for us.
I come with a model and I want to be like her. I want to have my legs like her. This is hard.
You are not that model, so of course we are trying to do our best. However, everybody's body is different, skin elasticity is different, fat collection, bone and muscle structures are all different. We are trying to do your best, not we are trying to make you like the artist model that you want to look the same. So you are my patient, not her. So I'm gonna treat you, not her.
Because I know that many women sometimes want to go beyond the limits.
Yeah.
For example, they want bigger breasts, not only the liposuction, the process, that a bigger breast that don't fit their body. So you're not that kind of surgeon.
Actually, our culture is important as well. For example, in Turkey, our women, Turkish women, don't like big breasts too much. But some cultures like America, some Afro people, they want to have big boobs. So we need to.
From America,
So we need to understand their needs, their culture, and their cosmetic expectations. If their cosmetic expectation is big boobs, we do, but of course in normal limits. You cannot put 500cc implant to a Turkish woman. It's a disaster. 500cc an implant is a normal in USA, for example, but in Turkey, the average amount is around 300cc, for example, because our cosmetic expectations more in normal range, because our people, our women don't like to look extraordinary. Be natural.
So
they want to be natural.
Your message for all the women is to be natural, to fit the body, and to do the best.
Yeah, I don't like supernatural bodies, but if their body's limit is okay, I try to do. As I told you, their expectation is important as well. But if they, for example, if her anatomically her body is narrow, but she wants big breasts, of course it's not possible.
So all the people understand that Dr. Resat doing all the things, aesthetic, plastic, and reconstructive surgery.
Yeah, right.
So
Totally.
any women can contact you, and
of course.
Especially the women with lipedema, is to have a good journey with all your colleagues. It's very good because some people don't have the way how to do and the financial.
Totally true, because lipedema illness is not a well-known illness, and also among plastic surgeons, not many plastic surgeons perform liposuction to lower legs because it needs highly expertise and you need to practice too much. That's why I'm trying to spread this lipedema awareness not only for the patients, for my colleagues as well, because I believe that knowledge you have get bigger when you spread it, because our many colleagues try to hide the information, the knowledge themselves, but I believe that it's not true.
Doctor, the last message for all the people that are seeing us.
Yeah. Last message, first of all, they need to realize that they have something wrong with their legs and arms. It's not just a fad. Yes, I understand it's not easy to manage their weight and shape of the legs. Please search this illness and understand what's the parts of this illness and how you can have your treatment. Then find your way, please.
So I'm gonna have the surgery. After the surgery, last question. Let's make it a little bit fun.
Yeah.
Can I eat baklava today? Yes or no?
It's a very
Or
difficult
it's a diet?
question. Maybe just a
I'm gonna
single
have a diet.
piece, just a single piece,
Just a
because
single piece.
it's
Okay.
it's a lifelong disease.
Doctor, a really good interview, and all the people can follow Dr. Resat Aktas to Instagram, and you're gonna see my journey too.
Yeah, thank you.